Low sex drive is one of the most common health complaints among American adults, and one of the most consistently misdiagnosed and undertreated. It is not laziness. It is not aging. It is not a sign that something is wrong with your relationship. In most cases, it is a symptom, and symptoms have causes, and causes have solutions. Here is what happens. Someone notices their desire has dropped. They feel guilty about it. Their partner takes it personally. And nobody goes to the doctor because the conversation feels too awkward, too vulnerable, or too easy to dismiss. So the distance grows, the guilt grows. And the actual cause, which in most cases is completely fixable, goes unaddressed for months or years. Today, 7 of the most common causes of low sex drive in American adults, both men and women. And a clear path for each one. Here is who I am and why this is credible. I'm Dr. Lauren Mercer. Today's content is based on research from the Journal of Sexual Medicine, Mayo Clinic guidelines, and clinical data from sexual health physicians across the United States. These are documented, treatable causes, not opinions. 7 causes. Let's go. The 7 causes. Cause 1. Hormonal imbalance. Testosterone is the primary hormone driving sexual desire, in both men and women. In men, testosterone declines about 1% per year after age 30. In women, testosterone and estrogen fluctuate with cycle, age, pregnancy, and menopause. Even small drops outside the optimal range can reduce desire. This is not a character issue, it is a chemistry issue. A simple blood panel can identify imbalance, and treatment options are widely available. Cause 2. Chronic stress. Cortisol, the stress hormone, directly suppresses testosterone. In a chronically stressed system, the body prioritizes survival over reproduction. Desire is not a survival function, so it gets turned down. American adults report high stress levels, which directly correlates with low desire. Stress management is not just mental health work, it is sexual health work. Cause 3. Medication side effects. This is one of the most overlooked causes. Many common medications list reduced sexual desire as a side effect. These include SSRIs and SNRIs, blood pressure medications, hormonal birth control, and some cholesterol medications. If your desire dropped after starting a medication, discuss it with your doctor. Never stop medication on your own, but do have the conversation. Cause 4. Poor sleep. Research shows each extra hour of sleep can increase sexual desire the next day. Sleep is when testosterone is produced and the nervous system recovers. Chronic sleep deprivation, affecting about 35% of Americans, reduces both testosterone and desire. Fixing sleep often fixes desire. Cause 5. Relationship disconnection. Sexual desire in long-term relationships is tied to emotional connection. Conflict, resentment, and emotional distance strongly suppress desire. This is not about attraction fading. It is about the nervous system being unable to shift into desire while holding tension or hurt. Communication and couples therapy address this more effectively than any supplement. Cause 6. Body image and self-perception. Negative body image is a major predictor of low desire, especially in women. If you are focused on how your body looks, you cannot feel what your body feels. This mental distraction, called spectatoring, interrupts arousal. This can be improved through therapy and building body neutrality over time. Cause 7. Underlying medical conditions. Several conditions directly impact sexual desire. These include thyroid disorders, diabetes, anemia, depression, anxiety, and cardiovascular disease. In many cases, low desire is one of the first symptoms. If there is no clear explanation, get a full medical workup. The bigger picture. Most cases involve more than one cause. Stress lowers testosterone. Poor sleep increases stress. Relationship tension reduces safety. Body image reduces presence. They compound each other. That is why addressing multiple causes creates the biggest improvement. Low desire is not who you are. It is a signal from your body. People who treat it as a medical symptom, not a personal failure, recover faster. The framing matters. You are not broken, you are symptomatic, and symptoms respond to treatment. Step 1. Get a full blood panel. Check testosterone, estrogen, thyroid, and vitamin D. Step 2. Review your medications with your doctor. Ask if they affect your sex drive. Step 3. Fix your sleep. 7 to 9 hours is required. Step 4. Assess your stress. Manage it. Step 5. If needed, consider couples therapy. 7 causes, all documented, all treatable. If your desire has dropped, you now have a map. Start with the blood panel. Review medications. Fix your sleep. Most people see improvement within 60 to 90 days. Subscribe. Next video covers 7 sex myths Americans still believe. Comment below. Which cause surprised you the most?